All right, good morning. It is February 20th, and this is Senate Health and Welfare. So this morning, we're going to be taking a look again at S-189 with some testimony and then just committee discussion. And then we'll move on to 302 and 192. Ledge Council cannot be with us until after she finishes some work up on the floor. So we'll be just looking at bills together, which is perfectly good. So we have with us, and remember S-189 is the bill that, Kiki probably, is the bill that looks at, mental health response service guidelines. We've changed the name already to guidelines. It's not protocols any longer. But looking to make sure that there's some direction from the Department of Mental Health to folks who are responding to mental health crisis. And that includes a broad range of folks who are listed in the bills. So Heather is here. Welcome. Thank you for being here.
You're welcome.
Heather, are you there? Heather Simons, here you are.
Good morning. My first day with the mute button, evidently.
Good morning. Thank
morning.
you. Why don't you introduce yourself for the record, and then we'll hear your thoughts on S-189, please.
For the record, my name is Heather Simons. I'm the Executive Director of the Vermont Criminal Justice Council. Thank you for the invitation to join you this morning. I'm familiar with S-189. I wasn't asked specific questions with regards to the bill, and I'm happy to answer any, and I can certainly talk about our efforts at the Police Academy and the work with the Vermont Criminal Justice Council in terms of our mission with regards to wellness and resilience. But I did want to just clarify if there was a specific direction that you would like me to go in, or a question.
I think really just a general question about your support or lack of support for the bill, and whether or not the guidelines would be helpful to folks who are working with public safety and responding. It's not just public safety, it's others. And so I will ask that question, and Senator Hardy has perhaps a more specific question. Go ahead.
Thank you, Madam Chair. Thank you, Director Simons. It's nice to see you. I actually requested that you come in and testify on this bill because I wanted to make sure, given the work that the GovOps committee does with the Criminal Justice Council on law enforcement training and protocols, I wanted to make sure that this type of guidance wouldn't be, excuse me, something weird is happening in here. Wouldn't be either redundant or conflict in some way with the protocols, or be confusing or problematic with law enforcement protocols and the work that the council is doing. So just wanted to make sure that it dovetailed well and didn't cause problems.
Understood. So what I can do is tell you a little bit about the direction that we're going in, and walk through it, not too quickly, but really in a way that summarizes what our mission is and how we're looking at programming, and then see if you have questions. And I think what you'll find is that what we're doing complements other work in this area, and also our focus with the council and with the academy with recruits and in-service is that we take the information that we have learned with regards to trauma-informed agencies in general and trauma-informed programs in criminal justice, and build around that infrastructure so that we are bringing along law enforcement officers in a way that's strength-based and skill-based, meaning measurable. And what we know is that there really isn't one area of the work in criminal justice, certainly, that doesn't touch on everything else. And what I mean by that is, if we're going to work on cultural competence, if we're going to work on fair and impartial policing policies, that we would also need to pay attention to our demographic as recruits. And we're trying to hire a demographic that reflects our state and our communities and our future of state. And so we are pretty much, I think, in layperson's terms, we're kind of blowing up everything at the same time, because transformation in law enforcement across the country is looking at everything. So programs for resiliency, the ones that we know are doing the best are the ones that are building strength. So in other words, whether it's rearranging our schedule and learning structure to accommodate COVID, which is really wearing people out, that affects someone's ability to learn or someone's ability on the job, and can affect home life, which in turn affects coping skills on the job. So that's what I mean when I say there isn't really one area that doesn't touch everything else. We do a lot of education in our basic program on things like peer support and how important it is to connect with each other, but also we have to have top-down programs and policies that address freeing people up to take care of themselves in a way that they're not stigmatized or feeling stigmatized. And that takes a fair amount of work, particularly in a 24/7 environment that's really structured. So for us, it's been one step at a time in terms of the day-to-day and what our recruits need. But in addition to that, we have been moving steadily forward with the governor's recommend from the last budget year on a statewide job task analysis that looks at the job of all law enforcement officers in the state, and that doesn't leave anybody out. That's all sworn officers. And the goal of this task analysis is to determine from law enforcement how they see their work. And that in turn shapes how we'll move through our curriculum and determines what we're going to train. And part of that training package is a focus not only on cultural competency and skills and competency, but wellness, trauma, de-escalation, and with evidence-based training that's measurable, it's much easier to see success, which in turn has an impact on wellness. That's an overall view. I think the distinction that we really are messaging now is that it's not just a lecture, but that we are working with specialists and have a plan for a much bigger intervention program that addresses things like start where you are, tactical fitness. We have a different recruit than we used to. We don't have the same physical testing that we used to. So that means for some people, they're coming in less prepared. And so we have to adjust our fitness and wellness programs so that we can see progress without injury, which is another area that can cause a lot of stress. And this in turn will help us reduce numbers of people leaving. We're looking at things like sleep and how we can address that through 24/7 Academy so that we're not messing with people's sleep schedule, and also preparing them for a future where their sleep schedule might be different. And that has, as we know, there's so much more science around sleep and wellness, nutrition, food contract, how we are managing making sure that we're keeping a schedule with our contractors who do the food, but also address the needs of our recruits that are diverse in terms of, it could be nutrition for any specific health needs or problems that they're having. It could be a schedule that addresses their religion, et cetera. But all of this, as you can see, impacts everything else, and it can be very complicated, but we're moving through it at a pace where we know we're going to create the inevitability for success if we don't leave any of these areas behind. So,
Heather,
yeah,
yeah, thank you.
you're welcome.
This is a terrific overview of how you are working with folks at the training academy and helping them improve their physical and emotional and intellectual work. I guess the question is, the bill is asking the Department of Mental Health to provide guidelines to folks, including public safety and volunteer firefighters and EMS. So the goal here is to ensure that the Department of Mental Health has some outreach that will help inform the work that's going on in each of those sort of other professions. So will the guidelines intrude in any way or cause problems with what you are currently doing?
Well, having not seen them,
Well, you'd be a part of developing. and
yeah,
work-
I don't think so. I mean, I don't think, in a nutshell, this area for me, it's kind of like taking swimming lessons. You can't be too good of a swimmer, and there just isn't enough in this area, and we don't want to put a Band-Aid on an amputation. We want strength and resilience and employees that are happy, and sometimes we aim just a little too low to make sure everyone's okay. So I don't see anything that would not align in terms of our goals, and we'd be happy to support.
Thank you. Senator Hardy has a follow-up.
Yeah, there's a couple of things. First of all, Vermont Criminal Justice Council not named in the bill. It's Department of Public Safety, which is it's different.
I understand that.
So I guess, Heather, if you, I think you should be added into the bill to help produce the guidelines, but I also am not sure that you're understanding what the guidelines are for. It's for, not for the employees themselves and guidelines about mental health. It's for if there's an issue with somebody out in the field, in the community that is having a mental health crisis, it's guidelines on how to handle that mental health crisis in terms of first responders and what they do, including law enforcement. So that was my concern, was that guidelines on top of what are already strict protocols about what law enforcement have to do in a situation, whether that would be confusing or conflicting. So that's the question I'd love a direct answer to.
Yep, I understand. And thank you for clarifying that, because we did have a couple discussions about that internally. So, and I appreciate the time to give you the overview, because to us, it's really the same thing, which is if we are creating the demographic with the tools and skills that we need to, and that includes our outreach. For example, we're working with Molly Gray, with the Afghan Alliance on a long-term plan to recruit our new Americans, and what kind of support do they need to, possibly become part of the law enforcement community. And that's things like ESL classes and more training around competence. That in turn will help us develop the skills to go into the community and have better interventions in those areas of crisis that we're talking about. So I know it seems like I'm a little off track, but to us, we're like right on track, because we think this these are skills that are needed to intervene in diverse settings. If that makes sense. So de-escalation, which is often referred to sort of generically, also kind of implies that we're starting at crisis. We're looking at a future where we're not de-escalating, but that we can show the skills surrounding prevention and that we can
Heather,
collect
I
data
interrupt?
there.
Cause you haven't actually answered my question, which is, would these types of guidelines produced by all these other entities together collectively conflict or confuse already established or future established policing protocols related to responding to a mental health crisis? Not the training and the wellness of people, but the protocols that a law enforcement officers actually have to use at the scene.
I don't think so.
Okay. That was the question I wanted answered. And also that whether you wanted to have the Criminal Justice Council involved in developing these guidelines to make sure that they didn't conflict with protocols.
Yes, we like to be involved because we end up being the ones responsible for training.
Exactly.
So if we can't operationalize them, we can't train them. So I don't foresee any issues, and we're happy to be involved and appreciate the invitation.
Great, thank you.
Perfect. Okay, so, unless there's a problem with others on the committee, but we can ask Katie to add the, Vermont Criminal Justice Council. And Heather, thank you, and thanks for your work. I know you've been very much involved in our work on, Justice Oversight Committee and helped us, with our work there. So it's great to have you in to, our Senate Health and Welfare. Thanks for
Yeah,
being.
thank you.
We're gonna ask Nicole DeStazio, any comments you want to come up, please?
Sure. So for the record, my name is Nicole DeStazio. I am the Director of Policy for the Department of Mental Health. So I think if I can just kind of go back a little bit to what your question was. So I think when we downgraded things from protocols to guidelines is your concern, and the concern is like, which do you follow? I think the answer to that will be the protocols and the order of operations will be the thing that will follow on the ground. The hope will be that the guidelines will align with that, but some of these organizations have pretty unique goals and they may not be perfect. But I think in all of these situations, the protocols, so like the EMS protocol, the law enforcement protocol, would be the things that people would be held to in the field for the standard of care. And that the guidelines will be there, again, hopefully to align and be informed by all of the different types of protocols, both to fill the gap for organizations that don't currently have anything to follow or any help. But I don't think that they would necessarily be supplanting, and more would we ever, I think, be able to get to a place where every type of first responder can have a single protocol that is going to supplant, but I think that's something that we figure out. Like, so when we're thinking about drafting the guidelines, I think the Department of Mental Health can probably get a first draft guidelines by probably the end of the session, and then really engage in that stakeholder work over the summer and the fall to kind of hopefully find something by like the end of fall of this year. Is that helpful at all?
Yeah, I mean, as you've heard me say, I just don't want confusion in the field. And, when there are so many people and it's such a high stress situation, if people are like, what am I supposed to do here? There's these guidelines, these protocols, these best practices, these blah, blah, blah. I don't know what to do, and that would make things worse. So, it sounds like you're understanding my concern. I'm sure I'm not the only one who had this concern, but that was my initial reaction with the bill, and I just want to make sure that all the work, had that in mind.
So my concern is that the Department of Mental Health and mental health experts are providing information that will allow for effective response in a crisis. So I know we have an expert right now in public safety, but we don't know who else we have who's an expert at our municipal level or at a regional level. So it's really critically important that we have mental health guidance that is going to help people in trouble. So I just think about what happened over the weekend in it was Minnesota. Was it Minnesota? Yeah. And it seemed to me that they worked very hard on de-escalation, but I didn't hear anything about mental health involvement. So for me, it's adding that layer of mental health information that's going to really improve crisis response. I think our state is doing a great job, don't get me wrong, and our public safety folks at every levels are doing great, as well as our EMS folks. But I do hear from people that there's a need for greater involvement and more information from our mental health experts at the state level. So that's my take on the bill.
Yeah, and I think we're happy to be part of this conversation and continue to work together. And I think if it, like, we can make sure that a part of this conversation is developing an understanding about the order of operations of what to follow, so that
Absolutely.
that confusion doesn't happen in the field. And we're happy to come back and talk about the outcome of that. I just, at this point, don't know how to predict, what the feedback will be, so.
Okay. Do you want to add anything else?
I think so, unless there's other questions.
All right.
I don't know if anyone else in the room had stuff too. I know we're all.
I want to thank you all for your understanding and the kind of the direction we're going here. It would probably be an impossibility to have an MOU between every little EMS and public safety, municipal and otherwise in the state. I understand that, but we could have put you in charge. But and also working with our local DAs and SSAs and others who are so integral to all of this. So we'll add in the Criminal Justice Council, and then I think when we come back, we'll try to look at the bill in a final form. There are no criteria established in here for what is needed. Will be up to the group, and that is, I think, important. So we're gonna take a 2-minute break off live, and then we're going to move on to S3.